Yeah, okay. So we start. All right. Good morning, everyone. Good morning. So everyone please take their seats? We are starting. This is session one. Session one is the role of NPHIs and IANPHI in mitigating the impact of global health threats, reflecting on opportunities. Well, 2030 is just around the corner, and the SDGs remain unattained for most countries. The time between now and 2030 promise a sea of uncertainties, but uncertainties are like a coin with two faces, challenges and opportunities. Uncertainties need to be navigated smartly and strategically, using science and technology to anticipate opportunities. This will be the focus of this session. We will start with a brief talk on SDGs, which will be followed by a panel discussion with public health leaders. Time allowing, we will also engage with all of you on this topic. So we will get going with a short talk, which will be delivered by Dr. Paulo Bus. He is online. And Paulo Bus is the former director of Fiocruz and one of the founding fathers of IANPHI, and he's going to talk to us about SDGs. So, Paulo, are you with us? Paulo Bus, are you with us?
Yes. Thanks, Les. Good morning.
Yes. Good morning, Paulo. Please,
everyone
the floor is yours.
Rio de Janeiro, Brazil. I will speak in Portuguese because it's my home language, and we need to spread Portuguese among our colleagues, not only because it's a beautiful language, but also because we are organizing this meeting in Maputo, which is in Mozambique, which is a lusophonic country. So I will speak in Portuguese. Em primeiro lugar, eu gostaria de agradecer o convite da direção da IANPHI, na pessoa do prezado amigo professor Duncan Selby e dos queridos amigos do Instituto Nacional de Saúde Pública de Moçambique, na pessoa do Dr. Eduardo Somogudo, para esta palestra inicial. Eu saúdo também os queridos colegas diretores dos institutos integrantes da IANPHI, muitos dos quais encontrei em setembro passado no Rio de Janeiro, por ocasião da reunião dos institutos do G20. E também gostaria de registrar 4 momentos inesquecíveis da minha relação com a história do desenvolvimento dos Institutos Nacionais de Saúde Pública no plano global e com a IANPHI. Em primeiro lugar, a criação da própria IANPHI, que ocorreu no Rio de Janeiro em 2006, quando eu era presidente da Fundação Oswaldo Cruz, num esforço que fizemos juntos, Jeffrey Copeland e Pekka Puska, além de 39 colegas que estiveram no Rio fundando a IANPHI. Segundo lugar, a criação da rede de Institutos Nacionais de Saúde Pública, da CPNP, em 2007, depois de uma visita que fizemos, Félix Rosenberg está aí, e eu, ao Instituto Nacional de Saúde Pública de Moçambique. Então, um pequeno instituto, hoje, um potente instituto da região africana. Por isso, tenho que cumprimentar o trabalho feito por Ileste Jane e colegas. Em terceiro, a criação da rede de Institutos Nacionais de Saúde Pública da América do Sul, inicialmente em 2008 e depois da América Latina, ampliando a rede de institutos no transcorrer da segunda década do século XXI já. E agora, o esforço que estamos fazendo de tornar regulares as conferências dos Institutos Nacionais de Saúde Pública no G20, no grupo dos 20, incluindo a próxima reunião na África do Sul, que ocorrerá esse ano de 2025, sobre a presidência da África do Sul, e nos países BRICS, que reúne Brasil, China, África do Sul, como todos sabem, e outros países, e que se reunirão no Rio de Janeiro. Queremos fazer também a reunião dos Institutos Nacionais de Saúde do BRICS, para comprometê-los e orientar posturas, posições dos países BRICS do ponto de vista dos Institutos Nacionais de Saúde. A minha missão neste Annual Meeting 2025 da IANPHI, aqui em Moçambique, Maputo, é refletir convosco sobre a situação da saúde global e os desafios colocados aos Institutos Nacionais de Saúde Pública diante da saúde global, da crise que vivemos. E começo por reconhecer a imensa dificuldade da tarefa, razão pela qual eu peço-lhes que considerem esta exposição apenas como apontamentos iniciais de uma reflexão. Há consenso entre analistas políticos e especialistas em diversas disciplinas que o mundo vive hoje uma crise multidimensional ou uma policrise, que outros preferem dizer que é um processo de transformação. Eu prefiro o conceito de crise em todas as dimensões que se considere: política, social, econômica, ambiental e de saúde, e sanitária e de saúde. Tal constatação é também consensual em todas as inúmeras declarações e documentos emanados do mundo político global, seja no âmbito do multilateralismo das Nações Unidas e suas principais agências, programas e fundos, seja nos diversos arranjos e organizações plurilaterais globais ou regionais existentes, casos do G7, do G20, do G77, do movimento dos não alinhados, da União Africana, da União Europeia, da Comunidade de Estados Latino-Americanos e Caribenhos, da CELAC, aqui na nossa região, da ASEAN, no extremo asiático. Ou ainda nas próprias diplomacias dos países, das capitais, nas organizações da sociedade civil e também no setor privado. Essa é uma constatação comum a todos esses atores políticos nacionais e globais. Eu não vou me deter em detalhar aqui as características desta crise multidimensional. Eu vou apenas mencionar que a pobreza e a desigualdade estão na raiz dos imensos problemas vividos pelas nossas populações, inclusive na saúde. Nesse ambiente socioeconômico, que eu chamaria de hostil, se produz uma tríplice crise planetária, ambiental, como a crise climática, a perda da biodiversidade e as poluições de águas, ar, solo e também dos oceanos. Essas situações socioeconômicas, somando-se às ambientais, produzindo impactos tremendos sobre a saúde humana e planetária. E foi exatamente uma crise desse tipo, multidimensional, social, econômica e ambiental, que propiciou a emergência da pior emergência sanitária dos últimos 100 anos na história da humanidade, que foi a pandemia de Covid-19. Melhoramos as condições que geraram a pandemia no período pós-pandêmico? Não, creio que não. talvez tenhamos, inclusive, piorado as condições que levaram à pandemia. E esta é uma reflexão que temos que fazer. As condições sociais, econômicas, políticas e ambientais que propiciaram a pandemia aí estão ainda e talvez pioraram. Sobre essa policrise pré-existente, muitos economistas e analistas políticos afirmam que as medidas do novo governo dos Estados Unidos da América estão produzindo uma importante sobrecrise. As medidas tarifárias e outras medidas de caráter político e de caráter social, econômico e governamental adotadas por Donald Trump iniciaram uma inédita guerra comercial global contemporânea aqui em 2025, com riscos de uma recessão econômica mundial, aumento da pobreza e exclusão e perda de empregos por redução de exportação em todos os países em desenvolvimento. Mas as consequências mais graves são exatamente sobre estes países em desenvolvimento, que são mais frágeis. E dentro desses países, entre as populações mais pobres, que são as mais frágeis. Os impactos sobre a geopolítica são evidentes. Os países estão se fechando. Os Estados Unidos da América se retiraram da OMS, deixando um vácuo técnico importante e uma grave crise orçamentária na OMS, que precisam ser compensadas pelos outros poderes globais, como a União Europeia e os próprios países BRICS, que detêm capacidade econômica e técnica capaz de suprir os problemas da retirada dos Estados Unidos da OMS, se assim, politicamente, a União Europeia, por exemplo, e BRICS e outros países e outras regiões do mundo politicamente decidirem, e temos que decidir a favor disso. A OMS não pode ser abandonada nesse momento. Ao contrário, ela é cada vez mais necessária porque o aprofundamento da crise propicia condições para a emergência e reemergência de enfermidades, incluindo a esperada doença X. Tomara que não viesse, mas nós sabemos que é uma questão de tempo, muito provavelmente. A saúde e os sistemas de saúde em todo o mundo estão sofrendo tanto com a crise política e econômica globais, quanto com a crise geopolítica que se agravou. E esse agravamento da crise econômica e social produzirá mais doença e mais mortes, certamente afetando desigualmente os mais vulneráveis, as mulheres, as crianças, os idosos, os portadores de deficiências, pessoas e comunidades pobres. Na arena global, a retirada de um país política e militarmente poderoso das Nações Unidas como um todo produz consequências sistêmicas de monta. A saída do Acordo de Paris impactará sobre o clima e este sobre a saúde. A saída da OMS impactará diretamente sobre a saúde global. O desmonte da USAID e as ordens de redução de pessoal e orçamento do NIH, do CDC, do FDA terão certamente impacto doméstico, mas também mundial, dada a importância dessas instituições para a saúde global. As Nações Unidas, o grande espaço geopolítico multilateral, criado há 80 anos, que a ONU comemora 80 anos no mês de setembro, criado em 1945, sobre os escombros da devastadora Segunda Guerra Mundial, se encontra hoje em situação de grande fragilidade. A Carta das Nações Unidas, de 45, estabeleceu os compromissos dos seus Estados-membros, os 3 pilares da ONU: paz e segurança, direitos humanos e desenvolvimento. Tudo o que não se encontra hoje funcionando bem no mundo. E isso é
Paulo,
lamentável.
Paulo,
Assim é que vivemos num mundo sem
Paulo, tem
paz e
5 minutos.
segurança, como
Paulo,
atestam os mais de 150 conflitos militares em curso no mundo afora. Desde a trágica ocupação dos territórios da Palestina por Israel no Oriente Médio, com mais de 50 mil palestinos mortos, que se somam aos mais de 1.000 mortos e centenas de reféns retidos pelo grupo Hamas. A invasão e destruição da Ucrânia pela Rússia e os atrozes conflitos militares e guerras civis na África subsaariana e em outras regiões do globo. Em vez de esforços pela paz, o mundo se rearma. Mais de 2,4 trilhões de dólares foram gastos em armamento no ano passado, em 2024, gastos militares. E menos de 200 bilhões foram destinados à ajuda para o desenvolvimento. O grande processo civilizatório, representado pela Agenda 2030 e seus ODS, instalado pelos próprios Estados-membros das Nações Unidas em 2015, vem progredindo muito lentamente em algumas de suas metas até 2030. E também, por outro lado, está estagnado ou retrocedendo em dezenas de outras metas. O Summit do Futuro das Nações Unidas, realizado o ano passado, na Assembleia Geral, em 2024, e o Pacto pelo Futuro, resultante do Summit do Futuro, precisam ser ativados de forma urgente, visando alcançar condições mínimas para o alcance dos ODS até 2030, sem deixar ninguém para trás. Isto é, sob o princípio da equidade. Nesse ano, os governos dos Estados-membros e a sociedade civil, que inclui a IANPHI, se reúnem no âmbito do sistema ONU para discutir em profundidade o ODS 3, o ODS da saúde e bem-estar para todos em todas as idades. Inicialmente, ele será discutido na Assembleia Mundial da Saúde, agora, no final de maio, na sede da OMS, em Genebra. Depois, teremos oportunidade de discuti-lo na reunião do High Level Political Forum, do ECOSOC, em julho, também na sede das Nações Unidas, agora em Nova York, que é o espaço político que faz o segmento da Agenda 2030, seus ODS, como sabemos, o ECOSOC e o High Level Political Forum. E, finalmente, teremos condições de discutir o ODS 3 na Assembleia das Nações Unidas, em setembro, na sede da ONU, em Nova York. São 3 oportunidades para que a IANPHI levante sua voz, enviando mensagens dessa Assembleia Anual de 2025, aqui de Maputo, pedindo atenção e empenho político e técnico para a implementação das metas do ODS 3 e dos demais ODS, intimamente ligados à saúde e que são determinantes sociais da saúde. Que se cumpram as metas do ODS 3. Redução da mortalidade materna, mortalidade neonatal e mortalidade de crianças de 5 anos. Acabar com as epidemias de AIDS, tuberculose, malária e doenças tropicais negligenciadas e combater a hepatite, outras doenças transmitidas pela água e doenças transmissíveis, inclusive as tropicais negligenciadas. A terceira meta que eu quero relembrar do ODS 3 é reduzir a mortalidade prematura por doenças não transmissíveis, quer dizer, doenças do aparelho circulatório, tumores malignos, diabetes mellitus, doenças crônicas respiratórias, por meio de prevenção e tratamento, e que, aliás, importante destacar para a visão da IANPHI, será tema da reunião de alto nível dos presidentes das Nações Unidas em setembro, durante a Assembleia Geral. Doenças não transmissíveis será o tema desse ano de saúde. Então, caminhando para o encerramento, eu proponho que essa Assembleia emita uma declaração firme, bonita, contundente, em defesa da OMS e das Nações Unidas e remeta esta declaração, este apoio, oficialmente às direções da OMS e da própria Secretaria-Geral das Nações Unidas de Nova York, e que dê amplo conhecimento deste apoio à comunidade da saúde internacional. A IANPHI é muito importante, ela tem que ser um ator político de relevo, ela tem que ser um ator político que se manifeste nos momentos de crise. E o doutor Tedros, o secretário-geral Guterres, receberem uma comunicação da IANPHI, será muito importante, que eles tomarão em conta e comunicarão aos demais Estados-membros esta posição da IANPHI. E a comunidade internacional precisa conhecer uma declaração de Maputo que contenha este apoio à OMS e às Nações Unidas. O segundo,
muito obrigado.
Nós passamos
Paulo,
todos
muito
os
obrigado.
esforços como IANPHI, como Institutos Nacionais de Saúde, para a consecução.
Paulo, muito obrigado. So we heard from Paulo. Paulo, thanks very much for reminding us about where we're coming from as IANPHI, and also the importance of the SDGs and what IANPHI can do to keep reminding everyone of the importance of SDGs, even in the middle of a poly-crisis. So what we will do next is to engage in a discussion with members here of a panel. We have 4 panelists for our discussion. 3 of them are here in the room, and we have 1 panelist online. I will start with Dr. Tracy Cooper from Public Health Wales. And Tracy, the question I want to pose to you is on well-being economy. Is well-being economy a development that NPHI should be paying special attention to? Based on your experience in Wales, are there opportunities for NPHIs within well-being economies in the current health financing crisis?
Thank you, Ilesh, and bon dia. And just to start by saying a really big thank you to our wonderful Mozambique and IANPHI friends for such an amazing opening ceremony. So I'm not sure how I can't speak for other colleagues, can follow that in this session. So a really big thank you. And Ilesh, if I may, just to begin with the same themes that have been said so far this morning, that I firmly believe that as national public health institutes and as IANPHI, this is our second leadership moment. The first being how we responded and protected our populations to COVID, the second being the context that we've talked about this morning. And Eduardo referred to a historical moment, and it really feels that today and tomorrow. And so where we get to by tomorrow, close of play, I think will be really important. And of course, as Paolo has articulated and other colleagues this morning, the current context of our trade wars, our polarization, the impact that is already having on our cost of living crises across our countries and the money available to health systems, wars, conflict, the impact on domestic security. And we're seeing in many of our countries the diversion of money from health systems to defense, to reinforce defense. Pandemics, synthetic pandemics, a constant threat for us. Paolo mentioned non-communicable diseases. We are seeing increasing in age-related cancers and the pandemic that is type 2 diabetes and obesity, and of course, the climate crisis. And every single one of those, even on their own, create a direct and indirect impact on population health. And put together, it feels like we have, if there is such a thing, multiple syndemics that are layering on top of each other. And as Paolo mentioned, that has the likelihood of further increasing inequalities and inequities for our already vulnerable populations in our countries. And so back to the leadership moment for us as NPHIs, the role that we play every day and how we accelerate that to be advising a couple of steps ahead to try not only to stabilize the health in our countries, but also mitigate the impact of those multiple threats should they materialize. And then, of course, IANPHI is perfectly positioned to push that leadership voicing nationally, but also to give effect and support us as NPHIs when for some countries it's difficult for us to communicate what needs to be done. So I think there's a real opportunity for IANPHI. And Nilesh, you asked me to talk about the wellbeing economy. So I think the wellbeing economy is a really good example of how National Public Health Institutes can use the core skills that we have for advocacy and for influencing. And I'm conscious not everybody may be familiar with what the wellbeing economy is, but at its heart, it positions the health of society as a fundamental, essential requirement for fiscal and economic stability. If we don't have a healthy society, we don't have people able to engage in good work, we don't have people paying taxes for as long as we need them, people are iller earlier, requiring more support and more costs. So it is a fundamental prerequisite for a sustainable society. So what it is, it's an approach that certain economies and governments use that prioritize human, social, planetary and economic well-being, the capitals, if you like, of a resilient society. And at its heart, similarly, to really position health where it needs to be, it's about trust, it's about social cohesion, it's about environmental sustainability and access to good work, all of which we need for healthy, fairer and prosperous communities. And what's a feature of, which I'll come on to, many of the countries that are driving this, is the particular areas of focus: mental health and healthy life expectancies, social well-being, economic well-being, and of course, planetary well-being. So the background of wellbeing economies is the WHO. Health in the wellbeing economy has been led out of the Venice office, focusing on investment for health and well-being. And the focus for them has been bringing ministries of finance and economy around the table to position health as a requirement for them to be at the heart of the health in all policies. So it has established a number of influencer countries. So Mika, pop your hand up, Mika. There's Mika. So we have our colleagues from Finland, from Iceland, from Scotland, from Wales, and Teresa, I hear Canada are increasingly getting involved, as is New Zealand. And there are a series of reports and documents that the WHO have produced to support countries and deep dives into these countries to bring to life how you actually drive a well-being economy approach to create a sustainable country. But what they've also done is identify the common attributes of those countries and of those governments. So these are equality and equity, prosperity, serving the needs of the current and the future generations. We can't just keep looking down, running on the spot. We've got to be a couple of steps ahead and be the custodians of our future generations, strengthening communities and sustainability and planetary actions. And so finally, you mentioned Nilesh, Wales. So we're delighted in Wales to be an active part of that community. We have a piece of legislation, which I think many of you may have heard about previously, which is the Wellbeing of Future Generations Act. And that is very much about shifting to prevention and long-term focus. And we are using it as a compass to navigate through these challenging times. We also have a WHO collaborating centre on investment for health and wellbeing and have produced a lot of resources around this that we can share through IANPHI that, for example, look at the prevention interventions across different sectors, give different government departments that have the biggest impact and the biggest return on investment or avoidable costs, to present that in a way for action to be noticed. We're also finally delighted 2 weeks ago to host a policy dialogue by the WHO with those 4 countries. And there is a growing momentum. We're very keen for other countries to be involved, to share resources, to come together, to think about how we navigate, as I say, through those challenging times. And so finally, in summary, we're all living at those times, aren't we? And how do we support each other as the position of public health leadership in our countries, and the power that we have when we come together through IANPHI and Duncan and colleagues is, I think, how IANPHI will help countries that are going to be struggling. We're all going to be struggling, but how do we mobilize the collective resources that we have to help each other rather than we just go away and look down and carry on in our country? So I think that's back to the leadership moment that we're in today. How do we really use each other's assets and auspices to drive a healthier globe, because we are really heading into some challenging times, but what an opportunity we have to share each other's resources. So I'll stop at that. Thank you.
Thank you so much, Tracy. My next question will be to Dr. Lul Riek. Dr. Lul is Director of Africa CDC Regional Collaborating Center for Southern Africa. And we continue on the theme of financing. So my question to you, Lul, is how can African Union member states mitigate the impact of decreased global health financing and ensure continued progress in strengthening their healthcare systems? And also importantly for this audience, what role could NPHIs play in this process?
Well, good afternoon, ladies and gentlemen. And let me also see this opportunity to say huge congratulations to government, to the peoples of the Republic of Mozambique for excellent hostings. The 2025 IANPHI Annual Meeting like never seen before. I think all of you agree that the opening session was magnificent, and they deserve a huge round of applause. Number two, also I'm very humbled to be part of this distinguished panel from some of people that I refer to as always. The history of African health security will not be complete without mentioning Dr. Natalie for the work that she did for many years. But colleagues, I'm going to turn my intervention into a little bit, when you preceded by your boss, the Director General of the Africa CDC, who has spoken passionately. And all of you should agree with me, it's a very strong voice. When he speaks, many people listen. And also is a champion, not only just for African continent health security agenda, but is a champion for global health security. And you know why? Because the African health security agenda matter to the global health security agenda. There will be no Western country health security guaranteed without Africa health security also being granted. Number two, I want you to rethink. And I would like to share two slides that I will just speak about them. The journey, the unique journey of the Africa CDC. It started in 2013 when three small African countries in West Africa reported Ebola that has brought the world into their feet. But Africa continent, despite of the panics, did not cry. I have seen it as an opportunity to rebuild back better, stronger, resilient health security agenda. In 2013, the head of the state and the government in our continent, they came together. We need to have Africa CDC. In short, you can say it, without Ebola in those three countries, there will be no Africa CDC. In addition, also the whole world has experienced another crisis, COVID. And COVID also for Africa, it was a huge challenge. The African continent was also left behind in accessing the life-saving, the countermeasure. But Africa did not panic, has turned it around to something positive. And because of the Ebola, today Africa has a roadmap. We call it the new public health order for our continent. And that new public health order has 5 pillars. And some of the 2 critical pillars is a call for the whole continent that you must have functional, operational, National Public Health Institute that's equipped with Emergency Operations Center. Now it's become a tool in the effort of African continents, from none to today, 25 African countries are established a National Public Health Institute. As you saw it in the slide presented this morning by Director General, our goal 2030, that no any country should be left behind without having a National Public Health Institute. Number 2 is we need to increase our domestic financing. That was clearly is a priority number 5 in the new public health order. That demonstrably we cannot, as an African continent, rely on other continents to finance something as important as our health. It did not work in 2021 after Ebola. It did not work when Africa continent now is responding to the mpox. And there is no guarantee it's going to work. And that's why you see the Director General spoke what was the roadmaps on how to ensure that Africa is self-reliant in terms of our financing our health security agenda. Those are the 2 things happen. Number 3, out of the painful situations, and not very long ago, it was last year when the whole African continent was also left behind in responding to the mpox. Africa did not panic, reveal backs. And for the very, very first time, for some of you remember this day very, very critically, and my younger brother, Dr. Eduardo, has the rare privilege to be part of that story. He is the chair of the ATC, a technical advisory committee that advised the Director General of Africa CDC and recommends that is about the time for Africa to declare mpox as a public health emergency of continental security. That was historic. It came out of that challenge. But to answer the question, to move forward, and I think the Director General also spoke about it, and he said with absolute clarity, we must rethink Africa health financing in this new era. And again, I need to add that we must change our mindset and how to think what to do. And what to do is, one is to strengthen domestic resource mobilizations. We also, it's not about we don't have enough money, but some of those money, maybe we are putting them in the wrong priorities. How can we realign based on the challenges that we are facing. And one of those, what kill people now? And which one can wait till the end of the year? We can do reprogramming. And this is what the National Public Health Institution is doing. But if you don't have a national public health strategy, if you don't have a health financing, you cannot make an informed decision. First thing first, let's encourage that the national public institution on our continent, as of now, take time to review your national strategic plans. If you have health financing, even it's better. You can be able to relocate and prioritize. Number two, we need to strengthen our primary health care in line with the universal health care and in line with the SDG 3. What we need, how we can strengthen the community health intervention, including the community health surveillance, is going to be cost effective, but it will ensure that there will be no any outbreak that will be happening maybe for a week or perhaps 2 weeks being reported, because all the community surveillance officers, they embed in the community, like always is being said, outbreak is starting community and end in community. Revenue generations, it could be maybe a long term, but how the government come up with magnificent strategy to tax some of the priority activity, alcohol, sugary, all things like those that also have impact into health. How can each country ensure that they generated an amount of money? And when you generated them, you need also to have policy clearly indicated that they should be addressing the health issues. Blending financing mechanism that has already been written, attracting the private sector, investing in some of the critical areas. Public health private partnership. I think it's about the time we need to look outside the traditional funding mechanism. Africa is have privilege to have those private, public-private partnerships in our continent. We need to reach out to them because they need healthy community for their businesses and for their private the system to work. We have seen it during the COVID. The whole world was brought down. Even if you have a good business, you lost money. So it's become easy for us to involve those into those businesses. The regional financings, investment, manufacturing supply, having procurements, full procurement also in the same things. So despite of these challenges in my conclusions and my contribution, we must remain resilient. And also I am confident Africa will indeed prevail and let the threats and the opportunity that we have into something that will protect us. DG has said there's a document also been published, Rethinking the Africa Health Financing, in line of what we are seeing. I urge all of you to take time and look into it because it's very, very guided. And there's so much advocacy at the very highest level the Africa CDC is doing in championing the domestic financing. Last and not the least, please take time, read the new public health order, be the champion because it's clearly left nothing behind and tell us what we need to do to own our own health security agenda. So I thank all of you for taking the time, and I will be available also to provide additional further clarification. Thank you.
So thank you, Lul. Our next panelist is Natalie Mayet from the National Institute for Communicable Diseases in South Africa. And Natalie, we did hear from in the opening session and also from Paulo Bus on climate change. And my question to you is, based on your experience in South Africa, are there opportunities that NPHI should seize to strengthen health adaptation and help build climate resilient health systems?
Thanks, Elish, and thanks to the organizers of the IANPHI conference and acknowledging the incredible work that has gone into preparation of this to the Mozambique colleagues from the Institute and also Mozambique government. Your generous contribution to making this a success is highly valued. So that's one thing we cannot control. And as scientists, we tend to want to control, but climate change is something that's uncontrollable. I scanned the literature of the 5 essential key components required to create climate resilience healthcare systems. And I reflected on these 5 components for our institution. And I must say that reflection was not a very good one in terms of our performance. And I'd like to ask the audience, how many of our public health institutions have either an environmental health strategy or a climate change strategy within your institutions? By show of hands. Okay. So I think this is a wonderful opportunity for us to reflect and to share and intensify our efforts in terms of strengthening awareness in the primary healthcare system. I think ask any nurse, ask any doctor in the primary healthcare system, they're seeing the effects of climate change, but are they actively engaging in mitigating those effects? And I think this is a role and a key strategic role of our public health institutions. Building the robust infrastructure. When you build a new clinic, let us inform the technologies to reduce the carbon footprint of that infrastructure. The adaptation to climate-related risks in terms of identification of the vulnerabilities, the surveillance, and the science-based interventions with monitoring and evaluation frameworks falls clearly into the ambit of public health institutions. Integrating climate change into all health policies, I think this is where we could muscle our way into ensuring that the primary healthcare facilities, all our facilities actually have policies. So currently we have pockets of excellence in our institution that deal to some extent with climate change. We do not have a strategy. We're beginning to realize that it's needed. In South Africa, over the last 3 months, we have had continuous rain. We haven't seen the sun. It was such a pleasure to see the sun this morning in Maputo. Trees are beginning to fall, and because there's just their roots cannot be sustained in the ground. Just coming to the airport yesterday, a tree fell over in our way. So the weather patterns have completely changed, and I think public health institutions are now realizing that they need to take the necessary action. So we've dealt with many outbreaks that required collective intervention with environmental health, human health, animal health, but it certainly doesn't give us the framework in which to operationalize a climate change resilient strategies for the healthcare system. We have the field epidemiology training program, and yes, we train across the multiple disciplines, but we don't specifically train in climate change. And Africa CDC has got a wonderful climate and health course. And if you look at the curriculum, it's really comprehensive. And I think IANPHI needs to review the curriculum and explore the opportunities of how that can be rolled out across the network of public health institutions. Yes, we have the legislation. We have the international legislation. We have legislation within the country. We have climate change, health adoption plans, but these are not translated into practical, implementable, visible initiatives. What does stand out in the country was the global hospital network intervention, where many of the hospitals are now beginning to reduce their carbon footprint, and there are a number of case studies that demonstrate how they've conducted interventions in waste management to reduce waste, to decrease the emissions, reduction of water and electricity consumption. And South Africa is still heavily reliant on coal for generation of electricity. But many of the hospitals have case studies which demonstrate clearly defined scientific parameters of their reduction. And I think this is where our public health institutions could play a wonderful role in collaborating with these large hospital groups in translating that down to primary healthcare facility level. Healthcare worker awareness is crucial. A lot of this work is being done in universities. It's being done with an academic perspective. And I think our public health institutions have opportunities to promote the sensitization of climate change initiatives across the board. So in closing, I think there are really 6 recommendations that I would like to make. And this is certainly has been a lesson and an eye-opener for our public health institution as well. Have the strategy. But when we have that strategy, it must accompany an implementation plan. That implementation plan must speak to the reduction of our carbon footprint as national public health institutions. And let's monitor, measure, and hold each other to account. So possibly at the next IANPHI meeting, we can demonstrate some of those variables and metrics that are being used to demonstrate reduction of carbon footprint in our respective public health institutions. Create the awareness not only within the institution, but also outside of the institution into the healthcare system. Leverage on our core functions and capabilities of surveillance to bring in the monitoring and evaluation frameworks of some of these interventions, whether they work, whether they don't work, and let us be the voice of advocacy, leveraging on the utilization of the data that we generate to influence policy decisions at political level. Let's leverage on our event-based surveillance systems for early warning systems. Mozambique is a good example in the observatory of the practice in that area. And let's start doing the research that demonstrates, can we link exposure, environmental exposure, climatic exposure of events with the impact on health, but also the research, multidisciplinary, interdisciplinary, multidimensional, to look at how we can generate our laboratory waste. Can we reduce emissions in our services? So I'd like to again thank you for this, but also learn the lesson from our opening ceremony, and that was edutainment. That energy was inspiring, and let's leverage on that energy to drive the climate change interventions. Let's use the muscle and the collective power that group had. So, and harness our unity is in strength as IANPHI to drive the climate change agenda. Thanks.
Thank you, Natalie. Now our last panelist is online, Youngmi Ji from Korea. Youngmi is the commissioner at Korea Disease Control and Prevention Agency. Our question to you, Youngmi, is on technological disruption. So based on your experience in disease control in Korea, how can NPHIs take advantage of the disruptive nature of some emerging technologies, such as artificial intelligence, to transform public health? Youngmi?
Thank you. Thank you for this opportunity to virtually participate in this IANPHI Annual Meeting as a new executive board member. I was happy to meet Ilash in Seoul a few weeks ago, and thank you for the question. As we all realize, COVID-19 pandemic underscored the need for data-driven infectious disease response policies in response Korea DCA, KDCA has enhanced its data use and analysis capabilities by restructuring rather fragmented data platform and improving operational efficiency and establish an open and integrated information system for infectious diseases and big data platform in 2024. It took a couple of years to establish those systems, and still we are adjusting two systems to make those better and user-friendly. And firstly, the integrated information system for the infectious diseases is being used in all public health sectors, including KDCA's regional centers, quarantine stations, and public health centers across the country, and other related government sectors as well as hospitals. And this system integrates the entire infectious disease response process from the point of entry and notification to epidemiological investigation and patient management. This enables healthcare professionals to systematically track and manage patient records. In preparation for this system, we standardized the epidemiological investigation form and collected epidemiological data and strengthened the linkage with external organizations, including Red Cross, National Fire Agency, and Ministry of Interior and Safety, and Ministry of Justice, and more. And this is a cloud-based infrastructure with a flexible operation system, such as database replication to ensure the system speed and security, especially for large-scale data processing during pandemics. And secondly, infectious disease big data platform is a dedicated platform that supports statistical analysis and research using data from epidemic infectious disease system. And this system implements pseudonymization techniques to safeguard privacy while enabling customized data access, thereby promoting research in the private sector. And this platform provides statistical data on major infectious diseases in Korea via an open API and dashboard. And accessibility will be expanded for international researchers with the launch of an English language dashboard within this year. And in terms of COVID-19 big data, KDCA integrated COVID-19 case and vaccination data with the data sets from other health sector organizations. Since 2021, KDCA's COVID-19 data, including the COVID-19 cases and vaccination data, has been linked with health data of all Koreans from the National Health Insurance Service, NPHIs, the world's second largest health data repository after the United States. In 2024, KDCA further expanded its dataset by linking COVID-19 data with cancer patient record from National Cancer Center, facilitating targeted policy development for high-risk populations. And we also generated the longitudinal multiomics data from 720 individuals to capture dynamic, molecular, and immunological changes throughout disease progression, from early infection to recovery. And this data set is publicly available since May 2024. And our COVID-19 big data, so-called KCOV-N big data platform, has provided data for 219 private sector research projects, and 36 papers have been published so far. And one research project leveraging KDCA's data received American Thoracic Society Award, and this was the first in Asia, as I know. And some research findings using this KCOV-N have been published in prestigious journals, including JAMA and Nature. And KDCA has made its best efforts to foster collaboration between public and private sectors by sharing research outcomes and apply those research outcomes to link to key policies, including vaccination guidelines. Also, our agency has made its full efforts to link data-driven technologies to infectious disease response, for example, forecasting modeling. And during the COVID-19 pandemic, KDCA developed big data-based infectious disease models to assess epidemic trends in collaboration with experts in AI, statistics, and mathematics. And with AI-based simulations, we analyze the effectiveness of interventions such as social distancing and restriction of mass gathering, providing scientific evidence for policy making. And in 2025, our agency is creating a national hub dedicated to infectious disease forecasting, bringing experts from various fields, including AI, epidemiology, statistics, and mathematics, to generate robust scientific evidence. And with this hub, we are trying to develop near real-time forecasting model for disease monitoring and provide policy implementation guidance. In the event of new emerging infectious diseases, this hub will rapidly shift into emergency response mode to guide early prevention and control strategies. And KDCA is also developing AI-based models to simulate epidemic scenarios for mid to long-term prediction to prepare efficient prevention and response strategies for future pandemics. And we are currently working on the human infection of avian flu, which poses a high risk of triggering a pandemic. And with AI-based simulation, we will analyze the spatial and temporal transmission path of outbreaks and evaluate the effectiveness of various intervention strategies. And these findings will support developing optimized prevention and control strategies in preparation for future outbreaks. And we also have a healthcare AI research division, and this division is working on the whole cycle of healthcare multimodal data from the collection to the processing, analysis, service, and as well as application. And Korean government also started a multi-ministerial biobig data project for 1 million population last year, and KDCA is playing a crucial part in this project, especially for the storage and of samples and data. And we would be happy to collaborate with all members of IANPHI to share our experience of using big data platform and AI and also learn from each other. Thank you.
Thank you, Youngmi. Please stay with us as we have a brief discussion with the audience here. I think we have time for maybe 2 or 3 questions or comments. So please just signal to us if you want to say yes, please. Can we have a mic? So just briefly introduce yourself and please make your comment or question.
Thank you very much. This is Walid from the Gulf CDC. Thank you very much for the organizers and for the speakers for their responses. I don't think that my question to Natalie, so I don't think there is anyone who disagrees about the importance of the environmental health strategy. And the only thing I think, and I would need your reflection on that, do you think really that we need that the environmental health strategy to be at the institutional level, at the Public Health Institute, or it should be at the national level? I don't know how the case is in Africa, but I think in our region, we have ministries, full ministries of environment, taking care of these issues related to climate change and so on and so forth. I don't think that by just focusing on the very specific health-related environment, we are going to make changes. For example, today here in Mozambique, we have very nice beach, but trying to make a walk in the early morning, the traffic, it was very, very difficult with the high volume of emissions from the car. It was not that healthy. I don't think Public Health Institute can have an impact on that unless the government, the whole nation, gets involved and gets into action. Thank you very much.
Yes, thank you very much. I'm Professor William Yavo. I'm coming from Côte d'Ivoire. I'm the Director General of NPHI of Cote d'Ivoire. So let me ask my question in French and also my comment because Cote d'Ivoire is a francophone country. Je voudrais remercier les organisateurs pour nous avoir invités à cette grande réunion. C'est pour nous un plaisir d'être ici et d'apprendre de chacun d'entre vous. Alors, mon intervention concerne le responsable de Africa CDC, voilà, qui a parlé de la nécessité du financement domestique de la santé, surtout au niveau des instituts nationaux de santé publique. Ce n'est pas peut-être une nouvelle question sur cette problématique, puisqu'il y a plusieurs années de cela dont on parle, mais le contexte dans lequel nous vivons aujourd'hui montre l'urgence d'avancer sur cette question et de trouver des solutions durables et efficaces pour relever ces fonds. Alors récemment, vous avez eu une réunion avec les ministres de la Santé. Est-ce que vous avez pu identifier les principaux obstacles, les principaux goulots d'étranglement qui font que cette mobilisation au niveau des fonds domestiques n'est pas optimale dans les différents pays? Alors, comment procéder pour lever ces obstacles également pour que sur cette question-là, l'Afrique puisse vraiment avancer? Je pense également que, en plus de la mobilisation de ces fonds domestiques, il faut que nous puissions parler davantage également de l'aspect efficience. Il faut que les moyens dégagés aillent vraiment vers les principaux problèmes et pour les adresser et avoir une santé publique efficace. Et nous ne pourrons pas avoir justement cet impact sur la santé publique sans l'engagement de la communauté. C'est vrai que nous parlons de financement domestique, mais il faudrait que ce financement domestique également soit allié à l'engagement de la communauté qui permettra justement de pouvoir avoir un impact certain sur la santé publique de nos populations. Je vous remercie.
I think it's, yeah, okay. Thank you very much for the panelists to reflect on opportunities. One of the things that we are seeing in many of our countries is that there is more and more tension within society. So to be able particularly to invest in new strategies and reflecting to what was said about in the first by Tracy, you need a social contract within countries to move into that. You need resilience, and because there's a lot of tensions around those things, and so could you reflect on that? Maybe Tracy or Nathalie, or within Africa CDC, you need this social contract to be able to move towards those critical issues and opportunities. Thank you.
Hi, good morning. Felix Rosenberg from Fiocruz, Brazil. I would just like to make a very quick comment related to climate change and in general to environmental impact on health. What I would like to suggest, and maybe in some time I can comment on some of our experiences, I think national public health institutes have to necessarily try to get intersectorial integration, because if not, it's absolutely impossible for us to act. There is one particular integration which we are dealing with and which I would like just to comment, and that is with sectors of ministries of what we call in Brazil ministries of cities. That is, we have to get integrated with urbanists, with architect urbanists, and with geographers in order to study and get with them together the impact of urban planning on health and how health can contribute with community participation in order to face environmental disasters, which are so frequent, so common. We cannot do anything by ourselves, but we can be of great help to a general integrated approach, particularly with city planning and with geographers working on environmental risks for the people. And this is certainly a health issue.
Yeah, okay, last question, then we...
Amir Ikram, I'm the Vice President for IANPHI. It's great to hear about, I mean, we're talking a lot about climate change, definitely one of the key and pivotal issues these days. But it's great side by side to hear about the development of the curriculum with the African CDC. And you already showed your intention that sharing with the IANPHI. So it would be kind of African CDC if it is shared with the IANPHI, and we look forward to how further it can be further strengthened, or maybe other institutes can take benefit of that, or maybe we take it to the other side of the human resource training like TEFINET and other bodies as well. Thank you.
Okay, thank you. So we have a number of questions and comments. So I just leave it up to you to decide who goes first.
Thank you. I'll perhaps pick up on Jean-Claude's question. Thank you, Jean-Claude. I think it's right at the center of how we connect with our populations. And we know trust is at the heart of that. And with the polarization happening at the moment and the interesting changes of politics, we're seeing shifts happening. And sometimes there's an appropriate shift and sometimes they're not. And interestingly, last year, more than 50%, just over, of the world's countries were having a general election. So it's an interesting time of change. So just a couple of comments, Elish, if I may. Interestingly, when the primary legislation of the Wellbeing of Future Generations Act was enacted 10 years ago, the preceding year was a whole mobilization of society on the Wales we want. So linking with children, young people, people in older age, businesses, etc., asking the public, what do you need? And that then begat the 7 goals of the Wellbeing of Future Generations Act, which is interesting. A couple of other elements. As Public Health Wales, we run what we call Time to Talk Public Health panel. So every other month, we engage with a statistically significant sample of the population, and we ask them questions about public health. We ask them questions about new food regulations. We ask them questions about climate change. And that then loops into policy and legislation. And as a result of that, we did a public health approach to the cost of living crisis in Wales to inform government decision based on what the population had said. And that helped contribute to a new policy of free school meals for children in primary school particularly, and early childcare. So there is a loop around, but it's back to trust. And the final point is working through civil society, because people trust people who live near them, sound like them, look like them. I think that's a really important lever for public health institutes. Thank you.
Thanks. I mean, certainly the comment around the intersectoral collaboration is hugely important. And that addresses the question from the Gulf. I mean, you have the Department of Environment, for example, who have their metric of monitoring air quality or water quality. But does that intersect with health data? And I think that's where public health institutions play a significant role, is intersecting and linking from an epidemiological perspective the exposure and health outcomes and health impact. And I think we need, as public health institutions, to create a greater visibility in that space of the work that is being done, so that when we do collaborate, it's done with a clear intention of improving public health. And on the point, I mean, certainly we can share the document from Africa CDC. I think it's available on their website as well, but I'll share that to the Secretariat. So the triangulation of data, hugely important. And from a social compact, you know, national public health institutions are designed to function at a national level. I worked at local government level, and that is really where the key impact happens, at that intervention level. That these are levels of government where they provide services, water, sanitation, roads, infrastructure. So I think that building the trust, building the social compact at that level, and translating our data of public health institutions from a national profile down at granular level, at district, down even at municipal boundary level to have influence. Thanks.
Well, once again, let me just also add my voice on behalf of the Africa CDC to acknowledge with absolute appreciation most of the comments and the concerns. But moving forward, like I said it in the opening session, we really need to think positively together, leaving no one behind. Like the Rethinking Africa domestic financings is being established. But it's being established with one purpose: to not leave anyone behind, but bring the best mind of African politician health, financings, and also the leadership. So the term of reference are being finalized, who is going to be part of those. But you can believe me in this, the way we are designing it is designed with the lens of Africanize the domestic finance for Africa health, using the resources the Africans have. Africa is not poor, but we need to rethink how we re-strategize, how we reallocate it to ensure that the health financing systems is not complicated. It's guided by the communities, the people. The more you involve community health workers, for example, you are not only just addressing the challenges related to the health security agenda, but also you're creating opportunity and job for those community health workers that may not even have another opportunity. A good example, 2 years ago, our continent and these regions had experienced 3 or 4 countries were reporting at the same time cholera. The turning point was until when the Africa CDC was World Health and UNICEF came together, supported countries to train, deploy community health workers in the most affected countries, districts. The result was magnificent. It's magnificent in such a way it's become the turning point on how to stop the cholera outbreaks. And the type of the community health workers that we recruited, they are not just retirees. No, they were very young college students who use their smartphone, going to their social media and make sure that they updated their peers. And it works. But the result was cost effective. It's almost $100 to engage a very young student colleague to mobilize their community and peers. So this is African way of designing it. It also worked in Uganda, and I saw my colleague, the head of the NPHI, Ebola was stopped in 73 days. And the reason behind it, because the community also were trained and deployed into most affected, the most at-risk areas, result into interruption of the transmission in 73 days. That's magnificent, and this is how we need to design this, but it still is a process. And once it's finalized, it's all of you or perhaps some of the National Public Health Institute will have a privilege to contribute either directly or indirectly. This is the way to go. Let's Africanize our health financings. Over to you.
Thank you, Lul. Young Mi, do you have any final comments?
Thank you, Elash. I just want to emphasize the role of IANPHI. So with the global issue of funding gap for WHO and other health partners, IANPHI's role will be very critical in addressing our global health challenges we all face. And this network should serve as a platform for country-driven regional and global actions and coordinated activities. I just want to mention about the Global Security Coordination Office, GISCO, which was established within KDCA in December 2023. And GISCO is coordinating our agency's ODA activities and interacting with countries to provide opportunities for capacity building workshops for NPHI. And I want to thank you all for recognizing our GISCO activities as one of the success stories in 2024. And my agency is ready to play an active role in coordinating our joint activities and country need-based training workshops, and will continue to make its full efforts to contribute to IANPHI, and hope to meet you all in person during the next meeting. Thank you.
Thank you, Young Mi. Well, so we come to the end of the session. I want to just maybe to conclude, remind everyone that as science-based organizations, our institutes are uniquely positioned to assist our countries, governments, and communities in navigating crises and uncertainties. We heard from Paulo Bus on how the world is going through a multidimensional crisis and lives a hostile socioeconomic environment. But we also heard that the SDGs remain our best hope to improve the health and well-being of our communities, and our institutes play an important role in keeping our countries on the right track. We heard from our colleagues from various countries on how institutes are harnessing opportunities amidst crisis. I hope you end this session with the notion that the scientific leadership we provide matters the most during crises and uncertainties. Shakespeare famously said, "Sweet are the uses of adversity." Well, that's true, but only if we are strategically positioned to take advantage of opportunities, working together with each other, but also with other sectors in our society. With that, I thank you. I thank the speakers, the panelists. I thank the audience for participating in this, and have the honor to invite you to lunch. Thank you.